Our subspecialty system, which is what we do at Tufts, takes faculty members, not hospitalists, but faculty members who are internists and subspecialists in their own right, and takes them to the bedside with you on these subspecialty services. So, for example, when I'm the pulmonary ward attending, it's myself, a resident, and an intern, and probably a medical student and/or sub-intern. But that's it. There's nobody else but us. And so we really have an opportunity to work very closely together, to see the patients together, and to learn medicine. And you get to see how I do it.
I strongly believe that the ward services should be run by specialists. And I also consider primary care wards that they're primary care specialists. So instead of a hospitalist, and we have nothing against hospitalists, we'll probably hire a couple here and there, but if you're on infectious disease, the person taking care of your patients and teaching you will be an expert in infectious disease. It's the most important part, I think, of our program, is the ability for our trainees to be able to see how life is as a gastroenterologist, how it is as a cardiologist, and it helps them not just learn more, but helps them figure out their career.
And what really drew me to Tufts, especially as a resident, was I really liked their subspecialty system that we have here. You have the opportunity to train with experts in every field. And as someone who started with a general idea of where I may be after residency but wasn't really certain, I knew that this was a great chance for me to learn about all the different fields and really, learn from the experts as much as possible about every field and really grow my own skills and learn what I really liked and allow me to the opportunities to work with them.
So, I wanted to learn about heart attacks from the cardiologist. I wanted to learn about COPD, from the pulmonologist. I wanted to learn about endocarditis from an infectious disease specialist, and really kind of dig into, all the different manifestations, all the different considerations with treatment, and not just be, consulting out to, someone else that I wouldn't end up, knowing. And so that's really the beauty, I think, of the subspecialty system here. You get to learn from the specialist, and you get to see a lot of kind of one kind of condition when you're on those services.
I think it's a really amazing opportunity having the subspecialty system. I mean, the attending that you're with is an expert in their field. So when I just came off of renal and having some of the most well-known nephrologists in the field to be my attending, to ask my questions, the high-level questions to just the most basic ones, they knew how to meet me where I was at in my learning and give basic answers, but also really in-depth answers. And they're always up to date on the latest guidelines and treatments. And so it's really such a wonderful experience learning from the experts in different parts of each field.
It benefits you in a few ways. One, spending so much time with these subspecialists on rotations, you learn really their detailed approach to the medical problems within their specialty. And I think that really helps you form your eventual approaches to these different medical problems. And additionally, for people who want to subspecialize, you get to spend a lot of time with these physicians and can build relationships and maybe work with them, doing research in the future that can help you down the line for getting into those fellowships.
And that exposure, I met a lot of good people from the department. I got into some projects with the department. I met my mentor through that. And it's been such a rewarding experience to have that contact that I don't think I really would have had if I had just if we hadn't had that sort of exposure. So getting that contrast, I think, really highlights how important it is for us to have that subspecialty system for our growth.
I think the subspecialty system is a huge advantage of Tufts because there aren't many places where you get to work directly with subspecialist attendings. When we're taking care of patients and learning from the medical problems that they have, the attendings teach on a more advanced level because they have that more advanced knowledge from their subspecialty training. I think it really takes learning to a different level.